So, yesterday we talked about insulin deficit diabetes. Now I am telling about insulin resistant diabetes. So, in the past we used to talk about type 1 and type 2. Now you forget about it. Now in India, obesity has gone up. So, the waist circumference above 80 centimeters for women and above 85 centimeters for boys or men should be taken as insulin resistance. This happens 30 years before diabetes can happen. Insulin resistance happens because there is a sudden gush of high carbohydrate, refined carbohydrates that we are taking. The blood sugar will go up. So the insulin is produced in a large amount. Free fatty acids are released, which are used with the glucose to convert into triglycerides. These large triglycerides, at the same time, the insulin prevents breakdown of lipids, adipose tissue, so the abdominal obesity increases. Above the age of 20, anybody who is abdominal circumference above 80 centimeters for women and 85 for men, you have to take it as insulin resistance. The peculiarity in India and China and Asian is till the end, the blood sugar will be normal, HbA1c will be normal. So they will be misleading. Anyone who has a low HDL, which is the first sign of insulin resistance. Second is if the triglycerides are very high, you have to think that the patient is going into insulin resistance and then from there to diabetes. The link is resistant hormone, which is produced by the adipose tissue. So in India and China, if they have the fasting insulin test, and if you do multiply it with fasting blood sugar divided by 405, it is called HOMA-IR, homeostasis assessment insulin resistance, which is more than 2.3. It is called a insulin resistance. Triglyceride to glucose, with the triglycerides into glucose divided by 2 log in calculator. If it is more than 4.3, it indicates insulin resistance. Insulin resistance happens 30 years before the diabetes. So, it's the tip of the iceberg, diabetes. So, by stopping the insulin resistance at a young age of 20 years, we can stop malignancy, this PCO, polycystic ovarian syndromes, and we can prevent heart attacks, brain strokes, multiple types of cancers, and all the obesity related disorders. So today the topic is insulin resistance and what is insulin resistance and why it is so important in India, how to identify it, and how to screen for insulin resistance, and what are the precautions. Say you have to every Indian should stop eating after 7 p.m. and 10,000 steps compulsory for every Indian, and low carbohydrate diet. Thank you.